The efficacy of the COVID-19 vaccines and their long-term effects are just two of the many concerns that result in vaccine hesitancy. As the Jamaican government moves to encourage more people to take the jab, focus is being placed on ending the misconceptions surrounding the virus and the vaccines developed to combat it. On Wednesday, the Ministry of Health and Wellness hosted a virtual discussion aimed at doing just that. Simone Absalom Gale has that story.
When contemplating getting immunized against the COVID-19 virus, one should remember prevention is better than a cure. That was the mantra surrounding much of the discussion between Minister of Health and Wellness, Dr. Christopher Tufton, and Chief of Staff at the University Hospital of the West Indies, Dr. Carl Bruce, and media practitioner Conrad Spence.
If you get a common cold and you can kick it off at home and you don't have to go into the hospital, you'll probably survive it. If you get COVID, once you have to go into the hospital and go into the ICU and go on a ventilator, then that's the time you're going to have a problem. So it's better to take the vaccine and prevent the severe disease than to take a chance and hope that you get through an intensive care unit. Because a lot of the people who get COVID, 1 in 12 of them also get clots. And that was one of the misconceptions. People thought it was a vaccine caused a problem. But the clots were in people who were getting the COVID.
Dr. Bruce is urging Jamaicans to not only consider the immediate health risk of contracting COVID-19, but also the long-term effects.
If you talk to the COVID survivors, a lot of them have heart disease. A lot of them actually have to go home with an oxygen cylinder, even though they get discharged from hospital. A lot of them have kidney disease. And then a lot of them, because of the damage done to the arteries of their penis, if I could say that, are developing things like impotence and infertility. And then you have what they call the brain fog and the brain damage and anxiety and psychiatric problems. So because you survive COVID does not necessarily mean that you're going to be doing better. The long haulers, as people call them, it is a significant problem and it has been understated.
Dr. Bruce adds that contracting COVID-19 often results in issues with blood vessels that seems to be the link to incidents of cardio-related illnesses. The neurosurgeon also responded to questions surrounding the use of alternative medicine or plant-based mixtures to prevent the virus.
Can Cersei or ginger or anything like that cure COVID?
I think what she's describing is trying to build her immune system. Mm-hmm. And we encourage, it's something that we always encourage in the Jamaica health system. We encourage a holistic approach. So we want you to build your immune system that if you get COVID, that you're in a better position to fight off the COVID. But the different bush tea or concussion that you believe in that help to build your immune system will not prevent COVID.
There's also the issue of the length of time it took to develop these COVID-19 vaccines compared to the time it took to develop others, like the rubella vaccine.
After Y2K, after 2000, we got the thing called SARS. It's the same SARS-CoV-1, call it that then, in 2003. And even before that, scientists were trying to find out how to make effective vaccines before 2003. But after 2003, what they're saying, instead of giving you a killed virus, a virus that they have killed, or a virus that they have made attenuated, or to use a term, less dangerous, like the measles, mumps, that kind of vaccine, smallpox. They just wanted to give a safer vaccine where they say, we're giving you a part of the virus that the virus cannot do without. So in this case, everybody see the spikes on TV. What they have done is made the spike again, the vaccine against the spike that you see on the virus. Mm-hmm. The virus can't do without that spike. But you don't need the whole virus for the vaccine. And so people mixing up and say, boy, is a nanolipid or a nano piece of fat or a small piece of fat. So a chip is in the vaccine. All nano mean is that it's very, very small. It doesn't mean that you're getting any chip. But it's a lot of research that has gone into developing this vaccine.
Almost 400,000 Jamaicans have gotten at least the first dose of the COVID-19 vaccine. The Health Ministry is seeking to vaccinate at least 700,000 people by the end of September. For the news on PBCJ, I'm Simone Absalom Gale.